When should you see a doctor? If you get a cold or the flu, most people simply stay home a few days and overcome it. However, some people get sicker than that and need medical attention. Even if you go to the doctor and nothing happens, it's better than waiting because serious problems can develop for some individuals who contract a cold or the flu. Fever. If you have a fever that is higher than 103 degrees Fahrenheit or a fever that lasts for more than 3 days, you should see a doctor. Trouble breathing. If you are having trouble breathing, have fast breathing, or you are wheezing, you need to get to urgent care to get checked out. You could develop a co-illness like pneumonia or bronchitis that will need to be treated with antibiotics. Change in skin color. If your skin turns bluish or yellowish, you need to get to the emergency room or urgent care as soon as possible. You may have low oxygen in your blood, or you may have a serious liver issue. Earache. If you are experiencing pain in your ears, especially if you also have drainage and no pain, call and make an appointment with your doctor. You may need more treatment to avoid further issues. Confusion, disorientation, irritability, or mood issues. If you or your child is confused, irritable, or moody during this illness, it needs to be checked out by a medical professional. Some problems can occur that are very serious, such as brain swelling. Problems waking up. If you or your child cannot wake up, it's imperative to get to urgent care or an ER, as there is a more serious issue that can be affecting the sick person. It's probably something else besides the flu or a cold if this happens. Seizures. In children, most seizures first accompanied by a fever are called febrile and are usually harmless. However, it is important to get medical treatment for any seizure, especially the first time. Worsening symptoms. If you were improving and now are getting worse, get to the doctor. Choose urgent care if you cannot get right into your doctor, as some of these illnesses progress very fast. Stomach pain or severe headache. Tummy pain should never be ignored, especially if it continues between vomiting or diarrhea breaks. If your head hurts very badly in the sinus area with lots of pressure, seeking medical attention can help. Persistent vomiting or diarrhea. Anytime you have persistent vomiting, more than a few times in an hour, and especially if you cannot hold down any liquids, you should get to the doctor. They have meds that can stop it. If you have a co-condition. If you have another condition such as diabetes, you should at least call your doctor if you think you have a bad cold or the flu. There are issues with the meds for you, and you need to get Theraflu or something to break your illness. Chest pain or pressure. Anytime you feel this way, especially if you have a cold or the flu, seek medical treatment at an urgent care or the nearest emergency room. Fainting. If you faint or you are very dizzy and feel as if you're going to faint, you need to call your doctor or go to urgent care. Swollen neck or jaw glands. This is a sign of more serious illness than a cold or the flu, as your lymph nodes are reacting and you may need more medication to help you fight it. Anytime you are unsure, it's best to err on the side of calling the doctor. It's understandable that many people don't or can't due to lack of access, but at least keep an eye on these symptoms to avoid serious complications. Thank you for watching our video. And don't forget to subscribe to our channel to get more tips on healthy lifestyle.